Hello and welcome to our little video today. My name is Mike Hess, and I am a respiratory therapist with the COPD Foundation and project lead for our World Oxygen Day initiative. I am very excited to be joined today by Nick Moore, Operations Manager for the Better Futures Collab Oxygen Program, Oxygen Collab, who we're going to have a very interesting conversation about some of the work that they've done and are releasing today on World Oxygen Day, October 2nd, 2024. Nick, welcome.
Thanks so much, Mike. And yeah, great to be here. I suppose happy World Oxygen Day, if that's the right way to say it. Great to be here.
So, if you could tell me a little bit about the Oxygen Collab and your background information, what is it that you guys do in the oxygen space, just for people who may not be familiar with your work?
Yeah, for sure. So we're a FCDO UK government funded program. Two partners who work together with many others alongside us in the space, DT Global and Brink. And we really kicked things off back during the pandemic and the COVID-19, where we often come together and look at tech solutions and innovation and how we can use innovation for good. And we were seeing back then a real inequity in access to oxygen around the world. I think probably everyone watching here could recognize that fact, that you couldn't get oxygen to many of those people who need it. And we saw the problem being oxygen concentrators that maybe weren't designed for the settings they were in. Lots of concentrators donated and breaking down. And as we started to dig a little bit deeper, we realized that that wasn't necessarily the problem, that was a symptom of the problem. And so we started the Oxygen Collab, where we started to look at how we could bring a systemic solution to trying to increase access to oxygen around the world, both supporting innovation in oxygen concentrators and oxygen products, trying to work out how to make it more affordable and accessible for people, and how to try and generate some of the evidence to make some key decision makers have what they need. So for us, this is a really exciting moment. And our work to date is too, that hopefully we're starting to nudge the needle and work with some partners to really start to increase access to oxygen in low resource and other settings.
Absolutely. I actually want to take just for a minute, pause, take a little bit of a broader view, because here in countries like the United States, where we have relatively mature healthcare systems and things like that, we may have this perception that oxygen concentrators are strictly for use in home settings, ambulatory care settings. But in many parts of the world, we don't have the luxury like we have here of just putting a flow meter into a wall and getting our piped in oxygen, do we?
No, for sure. And I think that's one of always the funniest ways that people realize the problem. That it was once said to me that the biggest reason that concentrators fail in North America and Europe is actually bacon grease, and it's the home care setting. But in these settings that they're being used in bedsides by patients, because there isn't access to liquid oxygen, maybe the demand at a healthcare facility is too low for a big PSA plant. Instead, they're looking at what we would normally use in a home care setting in an environment that's maybe not designed for that, or the concentrator isn't designed for. So dusty, humid settings, maybe electricity that's not as reliable, really challenging conditions. And so far, we've been trying to put products that really aren't designed for that into those spaces, and aren't too surprised when maybe they end up failing.
All right. So tell us a little bit more about this specific project with the results that are coming out today.
For sure. I think it's something we're really excited about. That when we were having some of that engagement and really trying to make sure we were adding to the sector, doing something useful, not just assuming we knew exactly what the world needed, but trying to hear it, we quite quickly realized that lots of these concentrators are designed for, as you say, that North America, that European setting, but they're being used in these other settings, in these low resource settings, whether it be Kenya, Uganda, India, other spots. And what we then quite quickly realized was the fact that if you're in a health center in Western Uganda, Northern India, there's no easy way to decide which concentrator to purchase, to have an informed decision on here is how this concentrator is going to perform. Here's something that I can rely on for my health facility for the next 2 5 years that we know is going to deliver life-saving oxygen. We realized that there just wasn't that transparency of here is what you should expect. So we at the Collab over the last couple of years have been working to really try and give people that evidence and that transparency, and really, hopefully, with these results, empower them where we can start to say, hey, here is what we think a concentrator should look like for these settings, with real help working with UNICEF and others to create a sort of target product profile of here is what a concentrator should be able to withstand, whether it's dust, humidity, electrical variations. And here is how these most common concentrators in the world stack up against it. If you're going to buy X concentrator, here's probably what you should expect with it. And we're really hopeful that with this, it starts to give some real transparency in the market.
Yeah, that's fantastic. And my personal view is that while we have this big divide between relatively high income countries and what we often consider low and middle income countries, there are a lot of places in high income countries that look a lot like those low resourced settings. I live in Michigan, in the United States, and we have rural parts of the country, of our state, even where it's a couple hours until you could get to a healthcare facility or a pulmonologist or things like that. And so you might, and your electrical power may be a little less reliable than we would normally expect. So do you think your results here, do you think they would also be translatable into more rural areas of higher income countries and help decision makers and purchasers in these areas?
We really hope so. And I think that's such a good point that it's not necessarily an us or them, and I'm here based in London, but it's a real reason that we call them almost low resource settings rather than low middle income countries or something like that. Because lots of the testing we've done, so around, as you talk about some of the electricity, but also operating temperatures, for example. Can one of these concentrators work in much hotter conditions? Maybe if there isn't air conditioning, or it's just naturally a hotter area. Similarly, some of the areas we've looked at would be around repairability and usability. So again, when you're starting to talk about those settings, it's really, hopefully, really useful for people to be able to start to get a sense of how which concentrator they might buy. I'd also add just actually that the results, they're really deliberately trying to show against sort of those criteria of usability, repairability, how they function in these settings, so that they can be ported over to lots of those different focuses or settings. And so somebody can say, oh, my real focus is dust and affordability. This is probably the concentrator that I need to buy for this setting and that I can probably rely most on.
On the topic of those results, can you give us a little bit of a summary? Did you notice any trends, anything unusual pop up at you? How are today's concentrators stacking up against that target product profile you mentioned?
It's a really interesting one. It's one that we batted back and forth for a while in how we present these results and kind of what we do with them. And really linked to your point there of different use cases. I think a real belief in us is actually that our aim is to give visibility rather than necessarily say, buy this concentrator. So I think you can see in the results that there are some quite strong concentrators that are quite relatively more expensive than others, performing quite well and nearly hitting some of those standards. And there are some that are a bit further away from what we'd ideally call that kind of perfect standard or that new standard. But our real hope is that actually, our real hope and our realization is that actually the answer isn't just here is the best concentrator in the world, but the decision makers, purchasers, biomedical engineers can say, my real focus is I want the best concentrator I can, but I've only got X thousand dollars to spend on a number of concentrators. Here is the best that I can go for. Or I'm in this setting. This is the concentrator I should probably look at. These are the key characteristics. So I'm slightly dodging that question, I'm afraid, but I think that that the answer could be for everyone watching to go and have a look at these results, because I really think that you can start to tailor them to what you're after. And that's what we hope will be the most valuable piece of this.
Yeah, I personally, I don't view that as a dodge at all. I think that's fantastic. We have, I don't know if there's an equivalent in the UK, but we have a magazine here, or a service, I guess, in the United States, called Consumer Reports, where we can kind of go to that, and it does a lot of those comparisons, and they do offer kind of, well, this is your best buy, or things like that. And I think we kind of get into that mindset that there is going to be a best, or things like that. But I think you have an excellent point that it's not necessarily the best, it's the best for a particular situation, because there's always going to be trade-offs. So I very much appreciate that. If you would, though, walk us through a little bit of how you did the project. How did this work? What were your key steps, and what was the process like?
For sure, it's really funny, and often looking at maybe this web page of results or a report and realizing what went into it, or kind of just how much went into that work to get that confidence, to get that evidence that hopefully brings the transparency. So for us, the process started quite a long time ago now, with working with UNICEF and Rice, who created that target product profile, talking to people across the sector, starting to say, what does good look like in these settings in the future? And once we had that, it was then a kind of obvious next step for us to start to go, okay, how do things stack up against it? And so over the last 2 years or so, we've been working with a lab of ours in Canada to kind of develop protocols which are now publicly accessible, so everyone can see how we did this testing. We had a sort of secret shopper approach as well, which was particularly entertaining, trying to get all these concentrators without people realizing this was the use case for them. And to really try and give some real rigorous testing that can both give people transparency, and do the innovators and manufacturers justice that we've done right by them, and we've delivered some really thorough and robust testing. We've then worked with ECRI, who in many ways, I couldn't remember the name of the US one you just mentioned, but here in the UK, we have an organization called Which, who's exactly that same thing, of those consumer results. And ECRI really plays that role for us in the healthcare market. And so we've partnered with them to share these results too, to bring that rigor. So it's been about a 2-year process of trying to define what good looks like, trying to work out how best to test against it, and then to do that testing. All of that time and effort to hopefully give a really useful web page, one report, for people to dig into.
Here in the States, we have discovered recently that in the portable concentrator area, there are some devices out there that have been advertised and promoted as portable concentrators, portable oxygen devices, that are available without a prescription, that are available without any kind of medical supervision. We call them Concentrators, because we actually put them on a metabolic simulator a couple of years ago now, and found that they really weren't up to the same performance characteristics. Did you find anything like that in the stationary concentrator world, where a device may have been marketed by a company that maybe has a low profile, or something like that, and really didn't hit the clinical specifications?
Yeah, I think it's a super interesting one, and it's one that we thought about quite a lot. As a really simple answer to that question, we used a 5-star rating, ECRI's standard 5-star rating, for the concentrators we tested. And ECRI has a rule that if something gets 0 stars, it shouldn't be purchased, and there are significant safety risks, and you should avoid that. None of the concentrators we tested got a 0. There were some that needed additional components to make sure that they were safe and that they could be used. But more broadly than that, it was a really interesting question. We chose initially 10 concentrators to test based on our work with lots and lots of healthcare centers around the world, lots of partners like UNICEF, those that really know the space and know what's being used, to find the 10 most common, most used concentrators to test and get those results. But it is also a real wild, wild west out there that lots of people have to end up using, and did in the pandemic, of if you need a concentrator in your healthcare facility and you've got $100, you can find one online that says oxygen concentrator, and you go and buy it. And either it won't give you oxygen, could cause some serious problems, or it will probably break down in a few days. And so that's kind of what we were dealing with a bit, that we hope we've tested a real range of the market to give an idea of some of those at the lowest end that you probably would go online and click on Alibaba and go, great, I'm going to get that one and get it sent over, all the way up to some of those highest spec concentrators that you'd often also find in sort of the healthcare, the home care market in the US and Europe.
Any other big surprises out of your work?
That's a good question. I think of the big surprises, it was really just the level of depth and thinking that needed to go into how you defined, how you tested, how you worked out what does a concentrator look like for these settings, but also how do you test for these settings? How do you try and test for 5 years of use in a rural health facility somewhere, where it's dusty, where it's humid, and try and really put these concentrators through their paces? The biggest surprise to me, I would say, is we spent a good couple of days trying to decide what level of sand we wanted in our dust testing, because there are catalogs and catalogs of sand, and trying to replicate conditions in some of these settings was, that level of detail was really, really interesting to me.
Oh, that's not something I ever would have contemplated. I mean, that's the amount and type of sand that's truly fascinating. And that really speaks to the level of detail that you all put into it. So that's really something. Um, so then what's next? Obviously, you've put a great deal of work and thought into the project. What is next for the data, and what's next for the Oxygen Collab?
The first thing I'd say on these results themselves is we almost consider it that we've done about 20% of the work now. It's taken us 2 years and we've done 20%. The next bit, the 80%, is getting it in the hands of those that will use it, getting it to places where it will be impactful and where we actually start to get visibility in the market and people being able to make those decisions. What's the point of us having tested this, produce these great reports, and they sit on a shelf? So for us, I think the next big thing with the lab testing results themselves is trying to get it into those hands. So hopefully for anyone watching who kind of goes, oh, this is super interesting, or even this is a little bit interesting, I maybe know someone that this could use this. That's the next step we really need to take with these results, and hopefully start to both bring some transparency into the market and also maybe have it as a bit of a rallying call and a bit of a moment to say, hey, there are some of these concentrators that could really innovate, and there's a space here to build a better concentrator for these settings, and hopefully maybe kick off a little bit of a innovation race to keep things moving in the market. Then I think more widely for us as well, we are working more broadly on kind of sustainable business models to actually help with some of the affordability for some of these concentrators and in some of these healthcare settings. So we've got lots of oxygen as a service, as we call it, pilots, where we're looking at how to make oxygen more affordable, but also have sort of all-round packages for these health centres, as well as kind of producing more evidence like this to hopefully start to move the needle and give an idea of here is how oxygen could be more accessible, more effective, and hopefully get to the point that these settings do have as much access as we might do in the global north.
Any other specific collaborations you're looking for? As you mentioned, hopefully we're going to get a lot of eyeballs on this particular video, and then your other work. Anything else that you're really looking to partner with somebody to develop or to grow?
I would say that we would love to hear from everybody, and if I was to sit here and think about all the people we've partnered with in the last 2, 3, 4 years, compared to where we maybe thought we'd start, we wouldn't have guessed half of them. So that's what's really exciting, and I would love anyone watching to reach out to the Oxygen Collab. For us, we're always on a kind of continuous mission, continuous role at the moment to both be looking at piloting some of this oxygen delivery, and seeing what the next technology we can help develop and help push on to. We're doing some work at the moment in supporting devices too. So if you have an oxygen concentrator, what backups are the right backups to have with it? What's the right remote monitoring maybe to really increase that access to oxygen? So people innovating in that space, in other spaces around oxygen, and people who are really interested in how do you start to make oxygen work financially. We'd love to hear from them and love to work with them.
So, on the note of hearing from you, first off, where can people find these the report that you're putting out?
So the main place for us would be on our website, which is makingbetterfutures.org. On there, we've got a dedicated web page to these results where you can start to really filter them, really make them work for you. So if you're interested in price and how they do in dust, we can give you results that look like that. If you're much more interested in how resilient to electrical outages there are, you can filter them there. So head onto our website and have a play around. We're, of course, on all of your social media, on LinkedIn, and Twitter, X, as the Better Futures Collab, as the Oxygen Collab. And we'd love to hear from people.
Great. And that's the best way to contact you, or is there another way that somebody, a potential collaborator or a research partner, is there a better way for them to contact you?
For others to reach out directly, our email address is oxygen@makingbetterfutures.org, and we'd love to hear from you, whether it's a message on LinkedIn, through our website, or via an email. We love hearing from everyone, and we promise to get back to you.
All right, fantastic. Any other last words for World Oxygen Day and your fantastic database of results, comparative results?
No, just big thank you for having us and for giving us the platform. And we really hope we can do the work to date justice, do your help getting us on this platform justice too. And it can really be something that starts to move the needle, both in terms of people being able to buy the right concentrator and also people innovating in the concentrator market too.
Absolutely. Nick Moore, thank you very much from the Oxygen, the Better Futures Oxygen Collab. Really appreciate you taking some time and all of your hard work and then sharing that hard work with the Oxygen community. Please be sure to go out and check out their work and their website. Contact them through social media. Keep an eye out through the World Oxygen Day network here. And we're really excited to see what comes next. So, Nick, thank you very much.
Thanks so much, Mike.